Hello, everyone. Thank you so much for joining us today. My name is Piper Steggy Nelson, and I'm the executive director of I Live Here, I Give Here. We are a Central Texas nonprofit dedicated to getting people to give back to the community in a number of ways, your time, your talent, and most often your treasure, giving back with your financial resources. We put on a big day every year called Amplify Austin Day in March. And we ask the community to give back to our local nonprofits. And as part of that day, we generally have about 30,000 people that give to about 750 local nonprofits, and they end up raising together about $10 million. And one of the things that we noticed through those Amplify Austin Day efforts is that there's a lot of money that will go to amazing issues like pets or parks, and things that are so important to our community. But at this time in our history, in our life, and frankly, in our Central Texas community, one of the things that we really wanted to do was lift up giving to our human community and really focusing on the needs of the people in our community. And one of the things that we noticed was that homelessness was a huge issue, and particularly family homelessness. So we started looking around at the issue of family homelessness and started realizing that there are some incredible nonprofits that are working on this issue. Just three very small facts before we get into this incredible panel. But locally, there are about 2,500 kiddos that are facing homelessness within the Austin area. Those 2,500 kiddos are a part of about 1,100 families that are either unhoused or underhoused, meaning that those 1,100 families are living in their cars, or they're living with six other families in an apartment, or they're living in shelters. They don't have stable housing. But the last thing that I'll tell you that we learned through all of this, and this is a great statistic that we got from both the Austin Independent School District and from Sunrise Navigation, is that about $1,200 per family will bring those families into stable housing. That $1,200 will pay off a debt, pay a first month's rent or a deposit, get those families financially to a place where they can move into stable housing. $1,200. And so, with that, one of the things we realize is that this is something that our community could do. You've got 1,100 families, $1,200 per family. How do we raise that? And so we worked with these incredible nonprofits to create something called Amplify Home. And that's what we're doing today, is talking about family homelessness, child homelessness in the Austin area. At the end of this session, I'm going to tell you all about what we're doing tomorrow in Amplify Home, getting people to volunteer, getting people to give their money, getting people to learn more about family homelessness. And so this is our sort of our kickoff, our hey y'all, hey community, let's talk about family homelessness, let's talk about child homelessness in the Austin area. And so with that, I am super excited to introduce our panel. I'm just going to go over their names and their organizations right now, but then I'm going to open it up to each one of them to talk a little bit about not only why they do this work, but what their organization is doing, and then we'll go into some questions. So first of all, we've got Christina Allen from Caritas. Thank you so much for joining us. Joanna Zapata of Sunrise Navigation. Thank you so much for being here. Melinda Cantu, my good friend from SAFE, and Kyle Walker from ECHO. I'm going to do this. You ready? Ending Community Homelessness Organization. Did I do it?
It's
Almost.
coalition, but other than that, perfect.
Okay, here we go. Here we go. Y'all, thank you so much for being here. So with that, I would love to just ask you to please reintroduce yourself, tell us what your role is with your organization and a little bit about what your organization is doing. And Melinda, I'm going to start with you. Tell us about what you do at SAFE and a little bit about SAFE, please.
Thank you so much. Okay, so I'm Melinda Cantu, just like Piper said. My pronouns are she, her, and I work for the Safe Alliance. We work with survivors of domestic violence, sexual assault, sex trafficking and exploitation, and child abuse. which means we deal with a lot of trauma. And we do this in intervention ways and supporting emergency and crisis situations, as well as long-term social justice supports. And we are also in the prevention space. We believe we need to do it in all of those aspects so that one day we don't have to do it anymore.
Stopping the cycle of violence, as I said, for 5 years straight. Thank you, Melinda. Kyle, tell us both about you and about Echo, if that's okay.
Sure. My name is Kyle Walker, she, her pronouns. I am the legal systems manager at Echo here in Austin. And I am also a person with lived experience of homelessness and substance use disorder and severe mental illness. So I am really grateful to be in this work today. Um, Echo, I think sometimes there's a misconception about what Echo does, but we are basically the policy and systems coordination arm for the homelessness response system. So we try to bring together funders, service providers, and public systems together. So that way we can come up with a strategy for the system itself to help families better. So anyhow, I'm really grateful to be on the systems advancement team. So this is, this is my world, trying to figure out how we can make sure that every child has a home.
Thank you, Kyle. And Kyle, y'all also do a point in time count. So your organization sort of leads the effort in terms of numbers, in terms of really understanding what the family homelessness situation is. Is that correct?
That is correct.
Yeah.
Yes, we do. Yeah. And as you can probably imagine, what a point in time count for one night, I think this year it was in January, reaching folks and finding folks is a massive undercount.
Yeah. Thank you. Thank you very much. Melinda does a lot of work with that's actually, I learned about the point in time count through Melinda. So look at that.
Mhm.
Christina, hi. Thank you so much for joining us. Tell us a little bit about yourself and about Caritas, please.
Christina Allen. I'm the Deputy Director of Partnerships and Collaborations here at Caritas. So I tell people, think of me as a professional networker. I try to eliminate or erase barriers for our clients and case managers, or I find ways to get resources. And so I tell people I'm a professional networker. Think of me that way here at Caritas to better serve our clients. We have been around for over 60 years serving the Austin community in homeless services. We're part of the homeless response system, providing both rapid rehousing and permanent supportive housing across our community. In particular, for families and children, we have 2 rapid rehousing programs that serve that community, which includes our veterans program as well. And so really with our services, we provide rental assistance for the families we're serving, connecting them, wraparound services, so getting them connected to medical services, job readiness, employment, anything that family needs. We do individualized tailored services to help them reach their goals.
Thank you so much. Thank you for being here. I think one of the things that I didn't know going into this because I'm a very much a neophyte. Joanna, I'm coming here both. Was just how frankly how few organizations were focusing on family and child homelessness, and so I want to thank you all so much for everything that your organization is doing. And Joanna, I have to tell you that Sunrise has just been phenomenal and such a huge part of this Amplify Home effort. So thank you so much for being here. Joanna, tell us a little bit about you and about Sunrise, please.
Absolutely, yes, ma'am. So my name is Joanna Zapata. My pronouns are she, her, and I am Sunrise's Wayfinder Family Specialist. So I primarily work with families that come to Sunrise, and I also work under the Wayfinder program. So we provide security deposit assistance and move-in fees for families and singles who are currently facing homelessness and also fleeing domestic violence or may be at imminent risk of losing their housing. And we help pay those move-in fees. We have a bucket of funds that we get every month. And so we try to help as many individuals and families to get into their housing. Sunrise is a large navigation center. We also provide food every day, Monday through Friday, 9 a.m. to 1 p.m. and on Saturday. We also have a mail service, so you can get your mail delivered. We provide verification of homelessness letters. For those to get food stamps, we have, similar to Christina, we also have rapid rehousing and permanent supportive housing. And then we also have a mobile team that goes outside on the outskirts of Austin to do some outreach, provide some meal kits, and give bus passes.
Thank you, Joanna. That's awesome. Y'all, what amazing organizations. And I want to say that in addition to the great organizations here, St. Louise House and LifeWorks and I can do this. Foundation Communities are the other three organizations that are benefiting from Amplify Home. So we're very grateful to you all for being here and to those organizations as well. Okay. So again, I am a neophyte and I knew nothing about the impacts of family and child homelessness until I started working on this effort in this day. And one of the things that I learned was, and this is based on stats from both a national organization and local organizations, but 80% of kiddos facing homelessness have encountered violence of some sort. That is just wild. It is just wild to me. And so I think one of the things that I would love to hear from you all right now is what are some of the unique challenges that kids and families facing homelessness are facing? It's a lot of facings, but there's a lot of challenges facing them. So what are they facing? So I would love to start with you, Melinda, based on the fact that I just gave a violence stat. What are some of the other challenges that families and children experiencing homelessness or lack of stable housing face? Can you tell us a little bit more?
Absolutely. And thank you so much for asking that question. It is such a big deal for any family who's experiencing homelessness or unstably housed, or that one medical emergency away of losing your apartment. Um, it, it is such a scary time that not knowing what's going to happen for an adult is really hard. But imagine for a 15-year-old, a 10-year-old, or a 5-year-old, not knowing if you're going to be able to go to school the next day. Education, that consistency is a real issue and a barrier for families experiencing homelessness. Being able to have access to the types of food that you normally eat, your schedule, what time you sleep, the things that you need to do homework, that so many things are impacted by even just worrying about what's going to happen next. So those things I tend to, because I'm a children's advocate by heart, that's why I started in this movement and in this work. Really thinking about young children and their needs has been really important, and to really think through what they may be experiencing. And sometimes they don't want to tell their parents that they're worried about something because they see them worry already and they know they're doing the very best that they can and they love them. And so thinking about, what am I going to wear tomorrow? Do I have those clean clothes? Do we even have access to anything that can get them clean? Those sorts of things are huge.
And intangible, right? Very hard to monitor, very hard to quantify, but also huge. And I so appreciate the fact that as adults, we're not great at facing insecurity. So as littles, and not worrying about those parents. Thank you, Melinda. I really appreciate that. Christina, tell me, what are some of the things that you all see, some of the unique challenges that your folks are facing?
What Melinda mentioned, right? Like trying to manage the day to day. You think about having to send your kid to school with clean clothes. Where are they going to do their laundry? You need to get your kid enrolled in school. You need those important documents for your child. It's not always easy if you're unhoused to keep your documents safe. So, how are you going to get your child enrolled in school if you don't have vaccination records, birth certificates? It creates another barriers for families to be able to keep their kids in school, enroll them in school. On top of, again, the day to day, what are your kids going to eat? I'd say another unique challenge is I see families are scared to ask for help. understandably, because one, there's so much shame and stigma around being unhoused in general, much less with the added layer of being a parent and it happens. And then they don't want to ask for help because of the fear of CPS being called. And then we can't get them connected to services. We can't get them back on their feet, right? If you don't know they're there, if they don't ask, if they don't tell anyone, right? Or they tell their kids not to tell anyone because they're trying to keep their family together. And so it makes it really difficult to serve people when you don't know they're there because they don't want to be found out of fear of CPS being called. I can tell you, I'll speak for myself. I'm not going to speak for other providers, but if someone comes to me for help, that's not going to be my first go-to, right? It's going to be connecting them to the services they need. So I say that in case any family hears this today, to know that we are service providers first. And then we go from there to see how we can connect you and go from there. But the childcare as well, if a parent is trying to get a job, how are they going to get a job if they don't have someone to care for their kids if they're not school age? That's another piece where how are they going to pay for that? Even if they find a job, what's going to happen then? So I'd say the CPS intervention and childcare, affordable childcare, are unique situations that they have to face to try to get back on their feet.
Thanks, Christina. Yeah, that's something that we've heard from AISD's Project Help as well, and I'm so grateful to you for highlighting it. That CPS piece is really scary, and it sounds like it really prevents people from getting what they need, which is completely understandable. So I'm so grateful to you to saying we are providers first. So thank you for that messaging. Joanna, I'm sure, first of all, I love the title Wayfinder. I really love that. Tell us a little bit about what you see. I'm sure that you echo what these women said, but what else do you see in terms of some of the unique challenges that your families are facing?
Absolutely. One of the most common things that I see is a very long shelter wait list.
Mm.
And so whenever we see a family, tell them, the thing I tell them is like, let's get you on the shelter wait list. Let's put your name on the queue because 90% of the time it's full and you don't know when you will be getting a call back. Another thing that we're seeing is a lack of like cooling centers. Maybe families can stay with others for maybe the night, but a lot of the times they cannot stay too long and they need to take a shower. Um, you know, Texas summers are extremely hot, so that's really hard for the kiddos to be out the park and not having access to go ahead and take a shower. Um, we're seeing a lot of barriers with rental debt. Sometimes that accumulates over time, and by the time that we're able to help, it goes to collections, and now we have that barrier of like not being able to pay collections, but we can pay the payees. So I would say those are the main three for sure.
Thank you. Thank you. There are so many challenges but you were able to um, list a whole list of things that I, of course, had never thought about. The cooling centers, the daytime places to go. I mean, not everyone can get to a library. Libraries are fewer and farther between than they should be. So finding those daytime places to take your kids. And then the collections, that was something that it is a hard one. Thank you so much for that, Joanna. Kyle, I would love to ask you, because Echo's not necessarily a service provider, is not a service provider. What are some of are there statistics, are there data points that you know of that are unique to families and kiddos facing homelessness, some of the challenges that they're facing?
I absolutely am not a data person. What I can, what I can tell you is I have lived experience, so I'll just be super transparent. I have we are a part of advancing the system that we currently have in place. Like we know that there are not enough resources, and our providers are doing such a wonderful job with what we do have. But what I can tell you is that for in my own personal life, I have adopted a child that experienced unsheltered homelessness early in their lives. And what I just want to highlight here is that the trauma of being unhoused for a child that we talked about earlier, it is something that does not end once housed. And so what that looks like for our school district is, not only attendance issues, but sometimes behavior issues. And it is a lifelong journey that, again, our providers and our communities are doing wonderful at helping folks, but we can't help who is invisible. And so that really brings up for me, again, that CPS piece. That's a huge that is something that I'm a big proponent of at Echo is, making sure that if we are in fact adding folks, into projects that are specifically for families, that there is no blowback at all, or any legal ramifications around exiting domestic violence and or substance use disorder, treatment. There are a lot of pieces to the puzzle whenever someone is, unstably housed and has children. And I think making sure that it's safe for people to ask for help is my number one goal in this system.
Thank you, Kyle. I appreciate that. And thank you for sharing your personal story and what's going on in your home. That's really, we're very grateful for that. So I just wanted to add on that one of the things that as we were learning more about family homelessness that we did learn was that kiddos who are unhoused are much more likely to become adults who are unhoused. And we also know that as many of you talked about, with schools and CPS that kiddos who are unhoused have a much harder time, could have a much harder time getting to school, staying in school, having the nutrients necessarily that they need to be successful in school. And so and they're more likely to get sick. Kiddos facing homelessness are more likely to have health issues and get sick. And so it's God, the layers that these kiddos are facing is really overwhelming. So I think with that, what I would love to hear from each of you is I think we have such myths that we tell ourselves about people facing homelessness in general, right? But specifically around families and kids facing homelessness. I think it's so easy to blame and to shame and I would really love to hear from you all. What are some of the things that you wish more people understood about families and kids facing homelessness? What are some of the things that you've heard, the myths or the untruths that you would love to dispel today? And Christina, can I start with you this time?
I have a lot of myths and things I would love to
Great.
dispel, but the first one I'll kick off is that people who are unhoused are drug addicts or have significant mental health concerns, and that is not true. When people, especially when they first enter homelessness, um, and so or the big one I hear is people choose that life, and that nobody, if you've actually worked with people who have experienced homelessness or been unhoused yourself, like no one chooses that. It is so hard just on the day to day. Just you have to think about every single thing you have to do that day to survive. And so that's the thing that frustrates me is I hear like, oh, just get a job, or that people choose it. And it is so challenging to live that day to day. And as I mentioned earlier, just to have your documents. How is someone going to get a job if they don't have an ID, if they don't have a social security card, right? And so I would say, without going into an hour-long spiel about this, since I have other panelists here, I think the key one I'll stick to for people listening and watching this is people don't choose this. If it was as easy as just go get a job, they would have already done it. And that's across the spectrum, single individuals, especially families. If it were easy, people would do it. They would not choose to be under a bridge or in our community unhoused. It's very hard.
Thank you, Christina. And I hate to be that person, but now more than ever, it is hard to get a job. So,
Yes, yes, very
um,
much.
Joanna, what about you? What are some of the things that you wish people understood about the families that you work with every day?
Absolutely. I wish that more people understood that moving in a family is not just expensive with move-in fees, but also now you have to worry about dressers and beds and mattresses for each kiddo. How many are you putting in a room? Who's growing, and needs more clothes? And what about the little ones with toys? So move-in fees is just one small component to help a family move into a home. Now we have to worry about household essentials, cleaning supplies, um, and so that is also really hard. And I'm really thankful that Sunrise has made several partnerships where we can help families get set up with furniture. But I wish more people understood that um, it goes way beyond just, giving someone a check to move in. It's, you know, even to kind of echo on Christina, like, yeah, having a job. A lot of people say, just get a job, but it's really hard to find a job between the hours of school from 8 to 2, 8 to 3, and make sure that you have your rent paid for as well. So that's what I would say that I wish more people knew.
Thank you. Yeah, our school system is not set up for working parents. My children are off school today. Luckily, they're teenagers and like they can walk places, but what? So I totally hear you. Thank you for that. Kyle, what are some of the things you wish that people understood? And I know that you have great thoughts about this. What are some of the things you wish people understood about kids facing homelessness?
Yeah, I think that everything that has been touched on already are kind of my thoughts as well, but the part about how once you get the keys, that check, problem solved. That is not that is housing first was never meant to be housing only.
Right.
I believe that
Damn.
this sorry. I believe
Love it.
that I believe that literally it is the supportive services, that it's what happens after the door closes, after you've gotten keys. Because when you're dealing with children, we're talking about childcare, we're talking about, schools. I mean, I remember when I was a child, I was upset because my mom wouldn't buy me name brand clothes. Like, these are kids who are just hoping to have a pillow or a place to do their homework. It breaks my heart when I see in these questionnaires that I fill out for my own children, like, do you have access to Wi-Fi? A lot of people don't think about the fact that kids that are expected to plug into tablets to do their homework, and when Wi-Fi, like, there is such a sense of not being enough,
Mm,
in so many areas
mm,
whenever someone is unable to take care of their kids, and just that stigma, having to make sure that we embrace everyone, and so often homelessness is a numbers game. And I think that families in particular flip that on its head, because, getting the most number of single adults off of the street is not the answer for our families. The most people for the least amount of money, it doesn't work with families.
mm,
And so I think that really humanizing, I'm so grateful for this platform, because really humanizing, these are folks, these are not, service point ID numbers. These are
mm.
folks, children that need mental health supports and childcare and transportation and community and love. And this is a really wonderful opportunity to make sure we spread that awareness.
Oh man, I just love that. Thank you for the humanizing part. And what it makes me think of as a parent is also what we need to be doing with those parents, which is lifting them up, giving them that self-confidence, making sure we know that they're doing everything they can to take care of this kiddo, or kiddos. Thank you for that, Kyle. Melinda, what's something that you really wish that people knew better, understood about the families and the kids facing homelessness.
It was interesting. I was sitting here thinking, just how amazing. I wish people knew how amazing these parents are. When you think about what we all have to do as parents, just we have to remember the appointments, the doctor's appointments, and how old they're, and then what are they going to do, the medication, and if you have a special needs child, all of that stuff that you need to follow up with. These people who potentially, particularly the 1,000 people that we house every night, they're needing to figure out how to maintain safety, and ensure that them and their children are okay. I want people to know how much they love their kids and how much they want their lives, their children's lives to be better. I really, really want people to understand that. They don't choose to be homeless. They don't choose to be leaving violence and abuse. They don't choose to be in those scenarios. They don't choose to have lost that apartment, but they do care about their kids. And they actually are some of the smartest people I know. They keep it all in their head because they can't write it down because they lose stuff. They're moving from place to place so many times. I want people to really understand. And that's just truth. And I've done this for 35 years. The fact that these humans are just so incredible.
Thank you. I really appreciate that. And it is true. And I feel like that's the sort of thing that we don't do a great job of empathizing about. But my goodness, right now more than ever, I could see that the line between being housed and financially secure and being unhoused and scared and unstable, it is a razor thin line right now. So I mean, it always is. It always is, honestly, but it sure is more apparently acute right now. So thank you for that reminder. um so one of the things that as I've come to this issue again, not knowing very much at all, we were talking to a group of providers, and one of the providers said, I was in a park a couple of weeks ago, and I saw a family that was living in the park, and as a provider, I didn't know what to do in that situation, and so I think this is a really hard question, and I gave you a heads up because I think it's really hard. But if you are encountering either kids or families that are facing homelessness, are unhoused, Melinda, maybe are facing violence, what are the resources that you as a provider, that you, someone steeped in this community, what do you tell them? What do you give them? What hope do you give them? What resources do you give them? What do you say to them? Joanna, do you mind if I start with you? You do this every day. So what do you tell families facing homelessness if you encounter them out in the world?
Absolutely. The first thing that I do is I give them a Sunrise Family Resource Guide. And so that goes over anything from childcare, applying for childcare solutions, emergency shelters, nearby food stamp offices. And then I also explain to them a little bit about our Wayfinder program. Um, I cannot remember exactly who, but someone gave me a form of like a cooling center nearby, maybe like the YMCA and like libraries nearby. So I also give them that. But the biggest thing is the resource guide. I always urge families, go ahead and get yourself on the wait list as soon as you can. And I give them more information about our Wayfinder program. Here at Sunrise, I make sure that they leave with food. And if not, we go ahead and make sure that we write them a verification of homelessness so that they can get emergency food stamps right when they get to the food stamp office and leave with a card of money for food.
Thank you so much. Okay, so you mentioned food and giving food. So I I keep tuna fish packets in my car for when I encounter folks on the side of the street. If I encounter a family, one tuna fish packet is probably not going to do a lot of good. What are some of the staple things that you might have on hand to provide to a family facing homelessness? Are there sort of standard provisions? And I know that this is such reductionist question, and I apologize for it, but I also just want to make sure that people have a sense of that they don't feel helpless, that there's something that they know that they can do in that moment. So, are there food staples that are particularly helpful for families facing homelessness?
Hmm. I would I would say maybe like food. It's really hard because a lot of the time, for example, our mobile team, we have food that's hot and ready. We pick up in the morning and we hand out to families every day. But if we, if that's not the case and we're not able to, food that doesn't have to be refrigerated, maybe more so like snacks like fruit, like bananas, apples, maybe some crackers, chips, and that sort of thing. Because a meal is really hard because we don't know if they're going to have a place to heat it up.
Yeah, good point. Thank you. Thank you very much for that. And also that the Sunrise Resource Guide, I might, if you're willing to share it, I would love to have that and put that out there. That sounds wonderful. Thank you very much. Um, uh, Kyle, I know that you are, again, not a provider, but I know that you also know this world. So if you were to encounter a family facing homelessness or a kiddo facing homelessness, what are some of the things you might do or say or provide to them?
Sure. So I think the first thing I generally do is ask someone what they need. I think so often we are giving folks things that they may not necessarily need. And there is a power dynamic when you're kind of like, so asking the question, what is it that you need? I've been so surprised by the answers. One time a gentleman said, I wear a size 15 shoe, and I've had these slides on and they're size 12, and look at my feet. And it literally was, $10 to run to the Goodwill and find a size pair of 15 shoe. They're giving someone their power to say what it is. It's a brave, and it's a brave thing to do, and also it humanizes the person standing in front of you. So I think that's the first thing. I always give out Sunrise's number for the Wayfinder program. But also, if there are children between the ages of 13 and 17, I always tell them about Common Ground at LifeWorks. It's a youth drop-in for teenagers. I think that can be an extremely difficult age. To have homelessness kind of layered upon all of the other pressures that go along with someone being a teenager. So that's generally, I'm generally trying to figure out, how can we, get this person surrounded with community and love. Also, the city of Austin has an amazing drop-in summer camp called Summer Playgrounds, and it helped. I just blasted it out. My kids go to it. It's at different city parks around the city, giving kids the experience of a real camp. Very transformational for the kids that I know have been able to attend. So please, we want to make sure that continues.
Thanks, Kyle. I appreciate the plug for continued support. Love that. I am so grateful for people like you who bring me in. What do you need is the right question. So thank you very much. Melinda, what do you have to add when you are, it's very hard to overcome what do you need, but when you're seeing a family or a kiddo, what do you ask or what do you provide?
I appreciate both Kyle and Joanna, both, but what you need is huge because we make assumptions all the time, and we need to not make assumptions because we really need to learn to not do that. Huge. But I think it's really, really important to have, if people do have access to phones, our safe line, the 267-7233, really, those people are on there 24/7. They can speak different languages, and it doesn't matter if you've experienced violence or abuse. They can connect you with whatever you need. And that's the question that they ask is, what is it that you need? It doesn't matter if you are looking to escape a domestic violence situation or have experienced the trauma that we work with. Anybody can call that number, and it's really, really helpful. And sometimes people aren't able to do that during an 8 to 5 situation. And so I think it's really important to be able to have that as well.
Thank you so much. I was in an sorry, y'all. I was in Amy's Ice Cream on Guadalupe, and they had a poster that my team and I created in 6 years ago up with the Safe Line number. So, Melinda, one more time, what's the number?
It's 512-267-7233.
Thank you, Melinda. Christina, what do you have anything to add? What would you add to this?
I'm going to reiterate the choice. Sometimes you don't know what someone's being, if they are being given something while they're unhoused. Like, there's so much that's just here, take it or leave it to the people we serve. So while I know it might not be realistic for people to have a grocery store in their car, but even if it's a variety of snack bars, right? It can be something that small, but to be able to give someone a choice to say, hey, I've got these 3 snack bars, which one would you prefer? Right? It doesn't have to be this big, again, grocery store in your car, but the things you can carry, right? Just to give someone the choice, because there's so much out there. Well, take it or leave it. Don't you want it? Aren't you grateful? It's There's so much lack of choice when you're unhoused. So something that small can really mean a lot. Again, as Kyle and Melinda already said, where you can give choice, or just, hey, what do you need? Let them identify it. Our client, as mentioned earlier, our clients are really smart. They're amazing. Like, give them choice, and treat them like another human being. I'd say it goes a long way. And then beyond that, I'd say for people in the community who don't do this work, right? You may not be as familiar with services. I'd say the simplest thing to remember is, on top of just asking, what do you need? If you do have items in your car you can share, that will help them get through the day. Awesome. Beyond that, to connect them to services, I send people, depending on what part of town they're in. If they're in South Austin, I get them to Sunrise, because again, Sunrise, the navigation center just provides that one-stop shop. So, because again, people in our community, you may not be able to list off 10 different resources if this isn't the work you do every day. So that's why I try to send people, if they're south, send them to the Sunrise Navigation Center. If they're north, I send them to the Charlie Center, because then again, they can do coordinated assessment to get on the housing wait list, get some food, get connected to insurance if they don't have insurance, get them on the MAP program for health insurance so they get access to care, right? So it just makes it easier to connect people to those one-stop shops. Because again, if you're unhoused, you may not have, even if you have a vehicle, you may not have money for gas.
Yeah.
So then you're thinking about trying to get on the bus. And if you give them 5 different resources, now they're trying to take the bus there. Like I say, if you're south, go to Sunrise. If you're north, go to Charlie Center, to just get that one-stop shop again. Because again, if you don't do this work, you may not remember everything, and that's okay. So I try to just those 2 main hubs. If you're near Caritas, we serve a hot lunch every day, Monday through Friday, no questions asked. Even if you are housed, because there's so much food insecurity in our community right now. Even if you are housed, we serve a hot lunch every day. We have a chef, and we get a lot of compliments on the food. We say yes, anyone, no questions asked. And we serve over, I think right now the number is over 200 people a day in our kitchen. And if you come outside of those hours, we usually have snack packs. So that way, if someone needs something, like we do, unfortunately, see a lot of people who are downtown, that's their breakfast. Unfortunately. So if you're downtown, we got your hot meal. We can connect you to these other services, but I just say that the reality is Sunrise and Charlie Center do a really good one-stop shop for all these different services.
For all the multiple services. Christina, remind us, where is Caritas downtown, please?
Downtown, we are at 611 Netches Street. So on Netches Street, just between 6th Street and 7th Street, right across from the Arch.
Okay. Oh, right across from the Arch. Thank you. That's very helpful.
Everyone knows where's that.
Everyone knows where the Arch is, of course. That's great.
Yeah.
Thank you so much. Y'all, I have to admit something. I was at a very large public event on Saturday, and there was a man sitting in front of the 7-Eleven, and he had a sign, hungry, need anything, and I just handed him a bar. And I said, "This is a protein bar. It's really good." And I'm realizing now how obnoxious. Like if I was just sitting on the street and I was letting people know that I was in need, but someone just shoved a bar in my face, I would be so pissed. So I want to thank you all for this conversation. You have opened my eyes, and I'm sure those of the people that are listening and watching too. Choice. We all want choice. We all want choice. I wanted to let y'all know that we're getting some really lovely, lovely comments and questions. First of all, someone says that they would like to like every single comment that you all are making. Thank you so much for doing this. And Joanna, another person said that they have referred a number of families to Sunrise, families and unaccompanied minors, to the hotline. And every time they've reported that the responder has been incredibly understanding and helpful of their situation and benefited from Sunrise's programming. So I don't know if you paid that person. I sort of think you didn't. So thank you for the work that you're doing. And then we had a really lovely person say more companies should be supporting this work. Preach. Um, and and then also asked um, the price of being homelessness, of being home, of facing homelessness, and particularly for a family. Some of the increased expenses, whether we're talking about single-use things because you don't have storage, or belongings that have to be disposable because you don't have a place to wash, or can you talk about some of the sort of unseen expenses of facing homelessness for a family? And I'll take that from anyone that wants to unmute and tell us about that.
Yeah, I think I can talk a little bit about that. I would say, I mean, I would start with moving. We have a lot of times when we have families that reach out to like, okay, I'm ready to move, but I don't have any help moving, especially like a single individual. Um, I have a bus pass, and I need to move all of my stuff over there. So definitely movers. Another thing is like sometimes individuals have pets, and pets are not cheap by any means. You have, pet deposit, pet rent every month. Renter's insurance is another really big one as well. You want to make sure that all of your stuff is covered and insured. And then I would say like all of them, for let's just say a single individual that's currently facing homelessness, they are going to need a bed frame, a mattress, they're going to need a dresser, a lamp, a table, a couch. And so it just adds up so much. I feel like those are the really big ones that stand out to me.
They're so, I'm so sorry,
Please go.
Piper. One of the things, and Joanna, that was so helpful. I think it's also noteworthy that so many times, people who are experiencing homeless, particularly families who are not wanting to be identified for all of the reasons that we already said, they may go from couch to couch, place to place. So they have, and every single one of those times, there's socks that are left, there's shoes, having to repurchase and get some of these things, it's huge. Being able to have, I think that the stable walls, it just makes things so much easier. And you tend not to lose those things. The documents that we talked about, just having to try to replace all of those things, I think it's really, that's also something I think is really just the expense can add up because you're having to replace things.
I mean, even when I had little kids, we would go to a restaurant and we would lose half of the things that we had brought with us. So imagine trying to move from place to place on a regular basis. Um, Thank you both. I wanted to let people watching and participating today know that we do have a Q&A. So please, if you have questions, put them in the Q&A. Your questions and your comments thus far have been super lovely. So keep that coming. Thank you so much. I'm going to ask you all for just some rapid fire questions. And so I would love to hear from each of you. First of all, maybe this isn't so rapid fire. Why do you do this work? If you can tell us why you do this work in just a couple of sentences, I would super love that. Kyle, and I'll start with you. Why do you do this work, Kyle?
Because I exited homelessness in Harris County, Houston in 2015, and I like to being the legal systems manager, I have a lot of forward-facing interactions with judges and lawyers and law enforcement. And I think it's really important for the public systems to be aware of the fact that, I am a real person and there is no one look of someone who's experiencing homelessness. And also, I just like to make sure that people understand that I it's the experience of being unhoused, right? That is not my label. It will not be my label for the rest of my life. And so I like to really it's important for me to also show folks who are currently having this experience that it does get better and that there is hope. And there are a lot of people that are pulling for us. Um, so yeah, that's why I do it.
Thank you, Kyle. Thank you. I really appreciate that. Jonah, why do you do this work?
Absolutely. I do this work because I'm really passionate about helping. I think being in a position where I wish someone helped me and then someone did, and I'm like, wow, you have no idea how much that means to me. I just hope that I can be that person, especially to families. It's it's just so nice to see, like, when we give them the check for their move-ins, they're like looking at us, they're like, you have no idea how much you helped. And I'm like, this just makes me so happy. Like, it makes me so happy that you've overcame so much. And at the end of the day, like, you did this. You're the one who's having a job, paying the rent. Like, it's just so amazing to like empower clients and be like, you can do this and see the end result. I think that's what makes me the happiest. And I'm also really passionate about helping children, making sure that they're housed because at the end of the day, they have no control over what happens tomorrow.
Thanks, Joanna. I'm so glad you're doing this work. I love envisioning you over there and talking to these families and giving them what they need. That has made me really happy today. Thank you. Christina, why do you do this work?
I am a fifth generation Austinite on both sides. So this is my community. And I both myself and obviously this is why I work at Caritas. We believe everyone deserves a stable home, a place to call home. And our clients are amazing. They're, as we already mentioned, that like I've had amazing conversations, met some incredible people through the programs that we do here. And I just love working with our clients. They're awesome. It's that simple. They're just really awesome to work with. And that's why I enjoy doing this work.
That's beautiful. I can imagine so many people looking at what you do and being like, oh my God, that must be so depressing working with so many
No,
people. You're
it's
like,
awesome. No, I love it. Well, like Joanna already said, right? Like when you help someone, and they did the work, right? Like we're just there to walk alongside their journey. But when you get that opportunity to see someone be housed, maintain their housing, live their best life, it's awesome to be a witness to that. And we just, I tell clients, I'm just here to walk alongside you. At the end of the day, you did this work. And it's just really cool to have the privilege to witness that.
thank you, Christina. I really appreciate that. Melinda, why do you do this work? Why have you done this work for 35 years?
I mean, because
You started when you were two, is
I
that
was
right?
two. I was
2 years
two.
old.
Yeah, two.
Congratulations.
I 100% believe that we can create a world where people have what they need. They are safe. They're in loving homes and communities that are fortified with what they need to live healthy and safe and wonderful lives. And I believe that I am able to do it, so I should do it. And I don't see broken. I see strength and amazing resilience and incredible, incredible humanity. That's why I do it.
That was such a perfect Melinda answer and such a perfect way to end this. Thank you so much. I really appreciate it. Y'all, thank you so much for being with us today. I'm going to just spend just 60 seconds talking about Amplify Home because my hope is that each one of your organizations, Sunrise and Safe and Caritas and LifeWorks and Foundation Communities and St. Louise House, these organizations that are doing this hands-on work with families and kids facing homelessness, that tomorrow you see the community come out in ways that are unexpected. And so tomorrow is Amplify Home. It is a pilot. It's very important to note that it's a pilot. I have learned lots of things about what we can do even better moving forward. But tomorrow, these incredible organizations have volunteer opportunities all day long. So each one of the organizations is offering the opportunity to come and tour a new facility or build welcome kits for Caritas or build cold weather kits. It was a little bit cold this morning. It's really make sure that the families and kids facing homelessness are getting what they need. And so volunteer opportunities available throughout the day. Those are available on amplifyhome.org. You can go and there's a section that says volunteer. You click on that and it has the opportunities and all the ways to sign up for that. The other thing that's happening tomorrow and today is we've got lots of educational opportunities. So today we're doing this panel. Today AISD is talking to its teachers and its staff about family homelessness and about how to work with families facing homelessness. Tomorrow, the Austin Apartment Association is doing some training and some information for their property managers about family homelessness, how to work with families that are facing homelessness. And in addition, we are doing a press conference tomorrow afternoon with the mayor, with council member Lane, and with some nonprofit leaders, and of course, the incredible David Gray of the Homelessness Strategy Office, talking about how the city and these incredible nonprofits are addressing family homelessness. And so today and tomorrow, lots of education opportunities, also information about that on Amplify Home. But the reason that this day sort of started is that $1,200 per 1,100 families to really move people into stable housing, move families into stable housing. And so tomorrow at amplifyhome.org, we are, as a community, raising money for the incredible groups that are working with families facing homelessness and kids facing homelessness. And I live here, I give here, and our incredible development dude, Jared, we found $30,000 in matching funds. And so for every gift that is given over $25, it gets an additional $25. So we encourage the entire community to show how much they care about family homelessness, to go to amplifyhome.org and give to these organizations that are doing the incredible work. Amplifyhome.org. Here we go. Y'all, thank you so much again for being here. Thank you for the work that you do. And thank you for humanizing family and child homelessness and making it so that it is not an other issue. It is something that we are all doing together, something that we are all working to empower folks as a community. So thank you so much. I hope you all have a good rest of your day and lots of very kind comments in the chat and in the Q&A if you want to check those out. So thanks, y'all. Have a good rest of your day.
Thank you.